And my advice to people treating frontline bladder cancer at the moment is there's a lot of uncertainty, and that means that the decisions are more difficult than they've been for some time. I am currently in a position where I am advising people who are biomarker positive to consider immune therapy. And the patients that I would consider for immune therapy are those patients who you feel you could have the opportunity to sequence the chemotherapy after the immune therapy if it didn't work. So those patients with relatively low aggressive disease, so patients with rapidly progressive liver metastasis, we know those patients don't do well. I suspect that includes the biomarker positive patients. But patients with a few lung metastasis or slowly a progressive disease, a period of trial of immune therapy to see if they're one of the winners seems attractive. This is currently a very cautious approach, and that may change this in the next 6 months when the randomized trials comes out and we can confidently say that this is safe and this is unsafe. We're not currently there. And the temptation when we're not currently there is to err on the side of caution. The caveat to that is patients are coming to us and saying they want the immune therapy because everyone wants the 1 in 10 chance of a one in between 5 and 10 of a long-term durable remission. And what I mean by long-term is long-term, and about a third of patients are probably getting some benefit. And many patients are saying, well, actually 2 months progression-free survival for chemotherapy isn't what I'm looking for. But I think until we know the detail of that in the frontline setting, we probably should be erring on the side of caution, and we should be selecting the positive patients and being confident that we can salvage them with chemotherapy if they were to progress. That's currently where I am. I know the global community doesn't necessarily agree with everything I say.